You know, if it wasn't bad enough that you or someone you love is suffering from chronic neck and back pain, add on the frustration of a doctor who has no other options, maybe giving you the runaround, maybe no answers. Are you still taking pain medications, going to PT and everything else, but you're still stuck in a rut with no end in sight? Dr. Miller from Total Health Chiropractic may have the answer for you. He's here with us this morning. Good morning, Dr. Miller.
Todd.
Frustration is just kind of adding insult to injury, literally, in this case. In some cases.
Yeah, you're exactly right. You know, we've talked a lot on this show about how pain affects quality of life, but one of the things we haven't talked about a lot is just the frustration that mounts with these patients when they're struggling with neck or back pain. A lot of times they're recommended to do, like you said, the physical therapy, different medications, shots at pain clinics, worst case scenario, neck or back surgery. And you know, it's just frustrating because these treatments many times aren't really fixing the cause of that pain. They're just sort of pain management. And that's why these patients have to keep doing those treatments over and over again. And, you know, sometimes their doctor might even say, well, go back and do therapy again. And they've already done it. It didn't work. And, you know, they're struggling with pain all this time. So very, very frustrating and painful.
Nobody likes that, been there, done that, but I still have to do it again with the pain feeling. So what are some of the conditions that affect the patients for, you know, there's surgeries and there's all, as you're mentioning, there's drug medications. There's a lot of different things that can affect them.
Absolutely.
Yeah.
Well, so a lot of times when they get to this point, they need these treatments or are recommended to do these treatments. It's due to degeneration of the spine, Todd. And what that means is the spine can rot and decay over a lifetime that you see on these models here if you don't do proper things to take care of it. But what we'll see with a lot of patients that are going through these things is they have discs that start to dry out and degenerate, where you can see it gets much thinner over here. The bones encroach upon the nerves and can cause a lot of pinching and pain. Other times these discs can bulge or herniate out. This model shows it nicely where that disc is pushing right out into that yellow nerve root there. And sometimes they get arthritis. Spinal stenosis is another big problem for patients. But it's all basically pinching and irritating these nerves, and it can be very painful in the neck or back. Sometimes it goes into the leg or the arms. And other times it's not even just the pain. It can be weakness in the extremities, where they have difficulty standing any length of time. You know, they feel like they have poor balance on their feet and concerns of falling down, where they always have to hang on to a spouse or a railing. And you know, a lot of times they just have to constantly keep sitting down, you know, do a couple minutes of work and then sit, and a couple minutes of work and sit. And it's a frustrating, painful way to live life.
Leanne and I were just at the Berlin Raceway over the weekend, met a man there who said he was going back for his third back surgery. Many people think that, well, they get a back surgery as a last case resort, and then what happens? You have to have another one.
And it's very rare, actually, for people to just finish with one back or neck surgery. And the problem with that, Todd, is that every level of our spine takes on stress. And so a lot of these surgeries are fusions of the spine, where they're bolting and fusing that area together. And it may help that level, but then the stress is placed right around that fusion, and those areas will wear down very rapidly. And you know, for a lot of patients, that then becomes the problem, and off to another surgery they go.
So let's talk about decompression and how that can help, which is what we're focusing on this morning, that DRX 9000. What can spinal decompression help?
It's really a great treatment, Todd, that we offer in our office, and it's non-invasive, so patients don't worry about the drugs, the shots, the side effects with surgery, or the risks involved. It's a very safe treatment and very relaxing for patients, but it's a medical device that helps to actually regenerate the spine and these discs, getting their back and their discs healthier. As you see here, it rehydrates the discs so that pressure comes off the nerves, and patients just really are able to get back to living a normal life, because we're fixing the cause of that pain and getting their backs healthier. We're not just masking the pain. And so we do have a lot of patients that have tried all these other treatments, and we really break that cycle with them by fixing the problem with this decompression treatment.
Not only do they feel better physically, but I bet that frustration probably ends too, where they're finally like,
a light at the end of the tunnel.
Finally something can work.
Absolutely.
And I know that we have a couple of testimonials of some people, David and Janet, both. Who do we have here? This is David?
This is David, and you know, it's not just for old people struggling with these problems or seniors. It can be young people as well. David's only 49, and his life had come to an end. He even had trouble just walking a couple steps from one room to another in his house, and certainly wasn't really working the way he wanted to. And he owned a business, and as it says on his testimonial, he tried a lot of these other treatments, just didn't really fix it. And he's done with the program now and back to running his company the way he wants, and very, very active and very busy again. So
excellent.
It was great seeing that change with David. This is Janet, and Janet also just finished our program, but like David, she tried a lot of these options. She had to sort of live her life around the pain and plan out how she was going to, function and do things, knowing that she'd have to stop and take a break. And even just starting her day was very uncomfortable, getting out of chairs, getting up out of bed. So we were able to help her degenerated discs with this program, and you can see how happy she is now, just living a normal life once again.
Living your life around pain. We want to end that and get you just living your life. So there is a new patient special that you're offering to our Fox 17 Morning Mix viewers.
Yeah, we just don't want them to give up. Even if their doctors have no other options, there are other options out there, and we suggest call our office today, set up an appointment. We'll do $50 off their first visit, but I'll meet with them one-on-one and discuss what they've been through, and do an examination and get to the root cause of their pain, and see if they qualify for our decompression program, if we can help them as well.
And the number is 828-0861. You get $50 off that first visit. This could end the frustration that you've been feeling. Get off the meds. Don't worry about the needles or the surgery. See if you qualify for the spinal decompression program at Total Health Chiropractic. Thank you, Dr. Miller.
My pleasure. Thank you.
You bet.